Something we're hearing from officials and from Canadians over and over and over during this coronavirus pandemic. We're in this together, and we are trying every morning on our program to highlight ways that neighbors and friends are helping each other get through this together. So let's show you a couple of things this morning that our viewers have sent to us. Tiffany Collins in Chilliwack, BC. See the sign? Please take what you need. She's put out things like toilet paper, pasta, and she sent this to us telling us Chilliwack is better together. Well, so's the whole country. Maggie sent this to us, her 8-year-old grandson, he too wanting to help the neighbors, so he made this sign asking people to sign up if they need help. Anything he'll do. Let's help each other. That is the theme for our next conversation as well. We're talking about the frontline healthcare workers and the stress that they are under as they deal with what is coming into the hospitals and the numbers that are in the future for the patients who may end up in the hospitals. They really are the focal point. So who is helping the healthcare workers who are helping the patients? Well, a group of medical students at the University of Toronto, for example. I'm going to introduce you to Orly Bogler. She's a fourth-year med student at U of T, and she is joined by Imaan Kherani, who's a first-year student and also part of this fantastic initiative. I don't know that it has a name, but let me just tell you it's fantastic because it's med students helping healthcare professionals. They're both with me from Toronto. Good morning and welcome to our program.
Thank you so much for having us.
Orly, tell me a little bit about your group. Who's in it and the kinds of numbers who signed up?
Sure. So first of all, thank you for having us on your show this morning. Our program was started about a week ago after medical school classes were canceled or clinical duties were put on hold. A group of us got together and thought it would be really great to help healthcare providers on the front lines with childcare, groceries, errands, anything that we could do to offload some stress during this time. So we set out a Google form, posted it on Twitter, on Facebook, other social media platforms, and got over 200 volunteers to sign up for this initiative. And we expanded our initiative not just from medical school students, but also other interprofessional disciplines. So nursing students, dentistry students, physiotherapy students, and we have so many people who are really excited to get involved with this.
That is incredible, a response of more than 200 at this point, wanting to help the healthcare workers. Imaan, is the thinking they're focused elsewhere? They have a lot of very important issues before them in terms of patient care and dealing with this crisis, so you're looking to offload some of those responsibilities. So what are the kinds of things, what are the kinds of ways you're helping them?
Yeah, so I filled out the Google form and tried to help in any way possible, and I was grateful to be matched to childcare. So I'm helping with a family of 2 young health professionals that are amidst their late stages of training, and I'm responsible for looking after and engaging with their 2 beautiful children. So that they can attend to their clinical duties and respond to the emergencies that are coming in and continue the care that they need to provide to their patients.
That's wonderful. That is wonderful. Maybe you're going to end up in pediatrics if you get some good training here. What about you, Orly? Tell me a little bit more, because it's not just childcare, although I'm sure that's a need that many doctors in their personal lives are feeling. But what other kinds of services and help are you offering?
Yeah, that's the main one, childcare, and then we're also providing things like pet care. A lot of people have dogs that need walking, cats that need feeding, so some students are doing that. And also things like grocery shopping, running quick errands, dropping off coffee and food to the hospitals when they're needed.
Fantastic. What kind of response are you getting from the doctors to your offers, Imaan? Well, not to your offers, but when you actually show up and help them? What are the doctors saying and doing in response to this program?
Yeah, it's just unparalleled gratitude. Many of the doctors, their schedules are so unpredictable and unstable at the moment. Because they are being called into emergencies and normal clinic days are being canceled and rescheduled or postponed to a later date. And so to have that stability in their life, where they know that there's some security in their personal lives, so they can continue to be present on the front lines, they are just so grateful for this act of kindness. So I really do applaud my colleagues and friends who have signed up for this active community, and I hope that they know that the doctors are very grateful.
Well, I would echo that. It's a wonderful initiative. Orly, what about you? In terms of seeing that kind of response, the difference that you're making so that the doctors can focus on their tasks at hand. How do you feel to be contributing in this way at these very unprecedented times?
Well, I feel really humbled by my classmates, by my colleagues, that everyone is so willing to give up of their time. We have a lot of it right now. And so personally, as a fourth-year medical student about to be entering into the clinical world myself come July, I felt that I really wanted to contribute in some way if I couldn't be actually working. And so that feels really good and helpful. And the responses have been just coming in, different doctors, nurses, other allied healthcare professionals emailing us saying how thankful they are for any amount of help we can give them. And that in this time, it's good to see a little bit of good in the world.
It certainly is. And Imaan, let me ask you the last question, because Orly's in fourth year, but you're just getting into this at first year, as I mentioned.
Yes.
You know, we're dealing with this very worrisome pandemic that is affecting the whole world and killing so many, and we still don't understand it, and we're a long way from, you know, getting to the end of this. How does it make you feel as someone entering the medical profession? I would think it could be either daunting or exhilarating, exciting in a way that this is the kind of thing that you want to deal with. I mean, how are you processing this as someone who's entering medicine?
It's definitely daunting and overwhelming. I think but it's incredible to see how the healthcare community, allied health professionals, physicians, our frontline workers are stepping up. It actually gives me a lot of hope and trust and faith in our world, in our communities. And so I'm just grateful to be a part of a field that is doing so much good in the world right now. So a little bit of both, daunting and exhilarating.
Well, best of luck to both of you in your studies and in your all of the things to come, fellowships and whatever else you have in store as you pursue your medical careers. It seems to me you have the stuff that we want in the doctors in our country. So a pleasure to meet you, and we'll be following your program and your initiative with interest.